Hi, so my name is Tyler and I am a registered midwife. I am one half of this new channel, Mother Birth, and we are so passionate about spreading education and informing mothers of their choices during pregnancy, labour and birth. So today we're going to talk about something I know that concerns a lot of pregnant women, especially leading up to birth, and that is how they're able to prevent vaginal tears during childbirth. So don't feel alone if you experience anxiety surrounding this. It's completely normal, and I think the more that we talk about these things, the more we can learn and get better outcomes. So what I'm going to be talking about today is ways that you can prevent tears or prevent the severity of them. So if you're interested in 9 tips and tricks that I have, just keep watching. One thing that I think is also really important, especially during pregnancy, is to familiarize yourself with your own anatomy. Get comfortable with your vagina, get comfortable with visualizing what's happening and looking at the changes. One of the most important factors, I believe, in preventing tears is having continuity of care. So whether that be through an obstetrician or a midwife like myself, having someone that you know can really help assist in preventing trauma. So how does continuity of care help? Well, it's simple really. You're able to have a plan right from the beginning about things that you're going to put in place to prevent tearing. Having that familiar face always so keeps you calmer, and there are so many benefits of continuity of care, which I'll go into detail in another video. But if you're able to have a care provider that can offer you continuity, then I would definitely look into that. The second thing I want to talk about is positions in birth. So some positions make you more susceptible to tearing than others. The best positions that have been found to decrease tearing is on all fours, standing and lying on your side. So those first two are really letting gravity do its work and really letting your baby come down naturally with that gravity. If you are in the position when you are on a bed, say you have an epidural, or that's just where you feel most safe and comfortable, then going on a side position can offer, first of all, midwives or obstetricians a better view of your perineum and able to assist you as baby is coming out, but also is a lot more comfortable and offers more space for baby to come through. Another really important thing is nutrition and hydration. So we can know sometimes when we're dehydrated, we get those dry, cracked lips. You can have dry kind of mucous membrane, so around your nose and your eyes, and the same goes for your vagina. So making sure that you remain hydrated in labor, even when you might not feel like drinking water, just taking some sips and making sure you have a nutritious diet full of vitamins and minerals actually reduces your chance of tearing. So it's definitely something to think about coming up to the birth and during labor. Another thing that can be great for reducing tears is water birth. If your hospital is able to offer water birth, it can be an incredible experience. It really allows you to relax, breathe baby down, and also the water can make your perineum more stretchy and prepared for baby to come through. Another thing I want to talk about is breathing your baby out in listening to your body as opposed to active coached pushing. So in some circumstances it is necessary for coached pushing, situations where baby might be distressed, or sometimes if you have an epidural and you do not have that sensation. But if you do not have any of these factors, there's no reason you can't let your body do the work. So when you are fully dilated, your body will naturally tell you to push, and you will find yourself doing involuntary pushing. So that is letting your body lead and your body bring baby down. When you're at that crowning stage, you might feel the urge to do a really big push to almost end the pain, but something that you need to focus on here is breathing baby out, relaxing and letting baby slowly come out. If you're able to prepare in your pregnancy mentally for this stage, it can really be effective. I've seen some beautiful births where the mother has not had to push at all and babies just slowly come down and out, and her perineum has been intact. So it definitely can be done. Another thing that can really help, and especially helps ease that discomfort, is a warm compress. So you can talk to your care provider, whether it be a midwife or obstetrician, about using warm compresses on your perineum during that pushing stage. This works much like the water birth, as I spoke before, just making your perineum more stretchy and allowing baby to come through. This also relaxes you and kind of helps control that urge to just push baby out. Another thing I want to talk about is doing your pelvic floor exercises. So if you've not heard of these, they're also referred to as Kegels, and essentially how you activate them is, imagine you're urinating and the muscle that you use to stop the urine is your pelvic floor muscle. So doing your pelvic floor exercise during pregnancy helps by strengthening those muscles and getting them prepared for birth, as well as creating this awareness of your pelvic floor. If you know what's happening and you can feel it stretching, it's a lot easier to control baby coming out. One thing that has also been found to significantly reduce tearing is perineal massage. So perineal massage is something that you can perform on yourself, but can also be performed by a partner and might be a bit easier. And what it involves is your partner taking their hands and doing kind of a sweeping action on your perineum, stretching it out. This can also help you mentally prepare for the crowning stage. This is something that can allow you to get comfortable with your body and start preparing for birth. If perineal massage is something you're interested in doing, I will link some resources below, so just have a look there. So one other thing that can also help is using a mirror during that pushing crowning stage. So being able to visualize what your effort is doing and how your baby's head is coming out can be very helpful mentally. So you can always bring in your own mirror if you're not sure if your hospital provides them, but it can be such an effective tool in actually knowing what you're doing. So I hope you found this helpful and you're aware of all your options and ways that you are able to control what's happening to your body. My last tip, and what I think is one of the most important tips, is using mindfulness and visualization. Actively strengthening that mindfulness muscle that is being present in your body and being present in the moment will help you so much in birth. Birth is way more mental than it is physical. So if you're able to start thinking positively about your birth, visualizing your perfect birth, visualizing your perineum stretching and breathing out your baby, then it is going to help you a lot. If you visualize it as it already happened, then this will help you so much during that crowning stage. So what I want you guys to know, that tearing during childbirth can be really normal. And the vagina is absolutely incredible. It knows how to heal itself, and I have seen them heal up so fast. So I do not want this to cause you anxiety and stress, because I promise you they do heal. I'm going to make another video shortly about caring for your vagina or perineum that may have had trauma occur to it during childbirth. But I hope for now that you are able to take on some of these tips and tricks and implement them. So I hope you guys enjoyed this video and it was of use to you. If there's anything you'd like me to talk about, any topics you're unsure about or would like explaining, then just write in the comments below and I will make them for you. Look out for new videos. I'm going to try and post about once a week. So thank you for watching, and I will see you in the next video.